As a non-operative orthopedist, I do everything up to surgery, so that involves diagnostic assessment, interventions, what may include injections, therapy, medications. If it gets to the point to where surgery would be needed, I refer to my surgical partners to take over from that point. When a referral is needed, yes, I can refer within the practice to my surgical partners. It's still in the same office. They have access to all the notes and workup that I've done, and often it's the same workup that they would have done, so it speeds the process up to get them into surgery. During the office visit, when the patient first comes in, we of course talk about why they're there, what symptoms they're having, but also try to get to know the patient. Every patient's unique, whether it's something that they need to get back to work, get back to a recreational sport, or get back to a competitive sport. We try to individualize their care so that we can help them meet their goals and improve from whatever they're being seen for. When I was younger, I was involved in many different sports, had a couple different injuries. When I had to have treatment, I was really impressed with the care that I got and the rehab that I got, and it seemed like all of the providers were having so much fun doing what they were there to do. So kind of latched on at that point, and throughout my career decided to become involved in sports medicine, doing something that I like to do, helping people out at the same time. By having both the athletic trainers and myself cover a lot of the events, it provides medical coverage right there at the game, helps make decisions on when it's safe for them to continue or not, and if it is, how can we better protect them to make sure they're not injured worse. We already have a heads up of what's going on. We can see the injury as it happens, which can help diagnostically as well. It helps the coaches do their job and let us take care of the medical conditions and provide safety for the athletes, and when it is safe for them to return, provide as much support for them to be able to perform at their best if they're able to. I think what makes Premier Orthopedics special, you can get care in many different areas, but I think with our case, it's the people that makes it special, between the physicians, the links that we'll go to, and the coverage where we're out in the community, and as well as the staff, the front desk, the physical therapists that are involved, the athletic trainers that we have. Premier Orthopedics offers a wide variety of services, including surgery from the surgeons, but myself, we do diagnostic ultrasound, which is a big part of my practice. We can do ultrasound right in the office, helps us diagnose correctly, sometimes avoids further imaging, helps us do ultrasound guided injections to improve accuracy and also outcomes. I also provide concussion care for our high school athletes, and just in general in the office, being a primary care trained physician, I can take a look at the overall health of the patient and sometimes provide additional insight to how other diagnoses that the patient may have can contribute to their current presenting problem. It's always important to treat everyone individually, and I always look at it just like if you were treating a family member. Really, we look at it as our patients almost as an extension of our family, and the same thing that I would tell my own mother is what I'm going to tell my patient sitting there in front of me, and give them the same options and try to look out for their best interests and help them come up with the right decision that's for them.